Welcome to Hershey Medical Center. I'm Caitlin, and I'm going to be leading you around the hospital today and showing you what all your fundraising and all your THON efforts do for all the children that are treated here at Penn State Hershey.
I'm going to do a little show and tell today. I'm going to take you around. I'm going to show you where your money's going. Each one of these heating blocks is $700. This is a centrifuge that keeps things at refrigerated temperatures. Each one of these is $5,000. This does PCR, polymerase chain reaction, you know, CSI. This is where DNA is extended. Each one of these, we have two of them, $8,000. So this one will rotate, but it will also heat up this whole chamber. That's $3,000. It's like a fancy beer cooler. It has a better, tighter seal, keeps things a little bit cooler. We have two of these, $5,000 a piece. I'm going to take you into the hall. I'm going to show you our tissue culture room. And you can see on the right side, these are all the hoods. And you can see in the further two hoods, you can see a blue light in there. That's a UV light. We keep the UV light on. UV will destroy DNA. So if there's anything that's any piece of bacteria or anything that we left in there. And over on this left side, you'll see these 6, one on top of the other. Those are our incubators. And that's where we keep our tissue culture cells. Thank you very much for coming, and thank you very much for doing what you do.
But you can see this new structure is the new Children's Hospital. Children's Hospital now is 5 floors, what it's going to be, and it actually has the potential to have 3 more floors on top. This will be the only freestanding children's hospital in this area. And the other thing that they're going to do is increase the room size. It's almost double what the inpatient rooms are.
My name's Julie. I'm a child life specialist, and I work with the inpatient hematology oncology children. We are here to support the developmental and the emotional needs of children when they're in the hospital. We have a department of 12. 4 Diamonds supports several of our positions. We are here to teach children about their diagnosis, about their treatment, and about how things in the hospital work. 4 Diamonds allows me to have lots of great tools to do that. One of those is a teaching doll. If there was something maybe going on in their belly, we can open up the doll. They have these cool templates. Well, now we have some anatomy, but it's cloth, it's soft, it's gentle colors, and then we can talk a little bit about what's going on in their tummy and how it looks in the doll. We also work with children to help them to cope with all of their tests and procedures and surgeries and that kind of thing. Our oncology patients have lots and lots and lots of tests and scans and procedures. So this is the treatment room we talked about when children are here in the hospital as patients. If they were going to have a lumbar puncture, a bone marrow aspirate, they're often done here. We try very hard to make this a room that's not as intimidating as it could be, because it is a place that when you come down here, you know there's going to be something happening that you would choose not to if you had a choice.
You've participated and been to THON many times.
Yeah, many times. I don't know if you guys can guess how old I look. I don't feel that old. But my first THON experience was actually, the first one I went to was 1993. To be honest with you, the money is a big deal, and that's part of the reason why it happens. But for me, it's much more than that. I go up there, and you know, just to interact with all the patients and all the students is great. I mean, one of my themes is I like to break down barriers between doctor and patient, and THON is so wonderful for that, because like things like the if you guys have ever been to the picnic and the carnival and the harvest day and all that kind of stuff, you kind of forget who's a doctor, who's a patient, and who's a student.
My name's Greg Bayaki, and I'm very pleased you guys were able to make it down today to come to our clinic and our hospital to see what all we do here at the 4 Diamonds Fund with our kids and families. So this is George Washko, and this is his uncle and his grandma, and they've been very important members of George's family as his treatment has gone on. So I'm going to turn things over to Grandma. Maybe she can tell you a little bit about how George is doing and kind of what their experience has been like since they've been coming here to the hospital.
Oh, they're so wonderful to us down here. And Greg, you're so great. As soon as we came into the hospital, he came, explained everything to us, and just made it feel much better. George is doing very well right now. He's in maintenance. He got through everything with flying colors. 4 Diamonds it's just the best thing. I can't even explain to you how much it has meant to our family. Not only just the money aspect of it all, because you can't even imagine. No one could afford it. No one could afford for their child to live if they had to pay for it themselves. I don't care how rich you are. I just can't even stress hard enough how much it means to us that you all do these things, and I get emotional every time I think of it because it's just so awesome. So many, they don't always show you guys. They show the guys that are picked up for the problems that are and there's so many good kids, and it's just so worthwhile. I just hope that you all know how much you appreciate it.
I hope by this time in your visit you have a pretty concrete sense of the impact of your fundraising. It really is very simple. If you didn't do what you do, there's just no way we could do what we do, so thank you very much.